Hello everybody and welcome to NESMP. It's Dr. Rojas here, and today we're going to be discussing the cardiovascular module, specifically hypertension. Remember that I give you all of the information under NESMP to be successful in your schooling and in order to prep and pass your certification exam. My method of teaching is consistent and for all diseases I discuss what the disease is, the risk factors associated with that disease, the causes, manifestations, diagnostics, and first-line treatment. At the end of each module, I also provide a fast facts slide with additional information on diseases that we didn't cover or have covered, and give you tips and tricks on how to remember certain things about them that are highly tested on. So let's go ahead and get started. So remember that in very layman terms, hypertension is when there is high force or increased pressure on the vessels as the blood is moving through them. And there are many risk factors associated with hypertension. And just to name a few, we're going to have smoking, obesity, genetics plays a factor in hypertension and the development of the disorder, stress, atherosclerosis, and medications. Age is also a risk factor, and having comorbidities would also be considered risk factors under the right setting. There are many causes for hypertension, but we usually place hypertension into two categories. Primary, meaning that it's usually idiopathic, and idiopathic simply means that we don't really know why it happens. And secondary will always refer to a cause that is elsewhere in the body. For example, renal disease can increase the blood pressure in the body because of the RAS system in it. Having comorbidities can also increase hypertension. So do you see that there's another disorder that then will cause hypertension to occur? Manifestations are pretty vague. Usually the patient presents with no symptoms, which is why hypertension is usually diagnosed at later stages and is such a dangerous disorder. Because by the time that we are able to identify it, microvascular changes and complications have likely occurred. When the patient does present with symptoms, the hypertension is usually a little bit more advanced, and certain things that we can see on examination would be like the copper wire arterioles, a patient complaining of a headache, flank pain, and renal issues. Diagnosis will be based on an ambulatory blood pressure monitor and home monitoring that helps identify what stage of hypertension they are in. And the treatment will depend highly on managing the other disorders that could be related to hypertension being present, decreasing risk factors when they are modifiable, and medications that help lower the pressure within the vessels, such as diuretics, calcium channel blockers, ACE inhibitors, and ARBs. To diagnose hypertension, I just want to talk about that a little bit more. We need to make sure that we're doing serial blood pressure readings and do a confirmatory diagnosis at another visit, usually within 1 to 4 weeks after that primary visit. In addition, I also want to discuss the two major organizations that set the standards for hypertension. Those are going to be your ACC/AHA and your JNC8. JNC8 is the one that delineates treatment goals based off of age, race, and diseases that the patient may be presenting with. So here is a very basic chart of hypertension. It's really important to just solidify this in your brain. If you have to write this chart down over and over again, that would be ideal because you just have to know these numbers. Okay, so blood pressure that is normal would be considered to be normal if systolic is less than 120, and, right, that's the key word, diastolic is less than 80. It may be considered elevated if systolic is between 120 to 129 and the diastolic is less than 80. And then we move on to the staging of hypertension. Stage 1 would be considered to be present if systolic is 130 to 139 or diastolic is in the 80s. And then stage 2 would be considered to be present if the systolic is over 140 or the diastolic is 90 or higher. So it's important to understand these readings. This is definitely a chart or levels that we would definitely want to know and be able to test dump with when we get to the testing center or during an exam and you're allowed to have scratch paper of some sort. This is an easy graph that you can just write down and remember. Righty? The AHA can break down the blood pressure readings into the 4 categories that I just mentioned. And again, I can't emphasize this enough. You need to make sure that you are understanding this chart and can identify all 4 categories and the specific terminology. Is it and or is it or? And here's your hypertension chart based off of JNC8. So remember that I discussed that JNC8 is the organization that sets the guidelines related to age, race, and diseases that may be present. So in general, anybody who is under the age of 60, the blood pressure goal would be considered at goal if it was less than 140 over 90. If the patient is over 60 years old, we do allow for some flexibility, and we would increase that systolic by about 10 points. So the blood pressure goal for somebody who is over the age of 60 would be less than 150 over 90. If the patient has any type of comorbidity and they're over the age of 60, such as chronic kidney disease or diabetes, the blood pressure goal would be the same as for those who are under the age of 60. So the only time that we really allow the BP systolic number to be increased by about 10 points would be if the patient is over the age of 60 and they have no comorbidities and are healthy. Alrighty? Otherwise, the blood pressure goal for everybody is considered to be less than 140 over 90. We've reached the cardiovascular system fast facts, and there's just a few things that I want to mention and make sure that you understand. White coat hypertension is a syndrome that occurs when office blood pressure readings are elevated in relations to home blood pressure readings. To rule this syndrome in or out, we will have the patient check their blood pressure at home several times, journal their readings, and bring those readings into office so we can compare to what we are seeing. A hypertensive emergency is determined to be present if the diastolic is over 120 with clinical findings of target organ damage, such as vomiting, intracranial pressure that is increased, a cerebrovascular accident, a TIA, or any type of hemorrhaging, usually within the brain. Isolated systolic hypertension occurs in the elderly, and it's due to the loss of the recoilability of the arteries due to atherosclerosis and due to age. So we would most likely see this in our older adults, and we would want to treat with antihypertensives, most likely some form of calcium channel blocker. JNC8 is the JNC8 is an organization that sets guidelines for treatment for all, so it's important to remember this. JNC8 and AHA differ in their readings, but they do not differ in the medications that are recommended to be utilized for hypertension. Those medications will include your thiazide diuretics, your calcium channel blockers, your ARBs, and your ACEs. Be mindful that I did not include beta blockers in this list. That is not a first-line treatment for hypertension per AHA and JNC8. Alrighty, I hope this fast fact slide was helpful for you and it helped you understand clinical guidelines some more and some very basic disorders that may be mentioned on certifications or on examinations for schooling. I hope this module was helpful. Don't make it more complicated than it needs to be. Again, my content reviews what you need to know and gets rid of the excess fluff that you may not have the brain capacity for right now. Remember that we are learning in a high-paced environment. We are actively taking care of patients while we're in school, and oftentimes we have personal lives that we are also managing. So in my modules under NESA MP, I give you the information, the hard and fast facts to know to prep for any school examinations or to prep for your boards to become a nurse practitioner. Remember that if you take the time to study and you review my content, we are always cheering for you and want to assure you that anything is possible and you will pass. Thank you so much.